December the 16th. Today, Dr. Ezike will kick us off with today's news from IDPH, but I want to first provide our most updated scheduled vaccine delivery figures from the federal government. Previously, federal authorities had notified us that they planned to ship out nearly 8 million Pfizer vaccine doses to states, large cities, and territories across the country next week. However, as of this morning, I'm disappointed to learn that the U.S. Department of Health and Human Services informed us that per the direction of Operation Warp Speed's General Perna, that estimate was tightened significantly, down to 4.3 million doses shipped nationally next week. The following week, originally projected for another 8.8 million doses, is also now scheduled to be 4.3 million doses. This development will likely cut our state's projected Pfizer shipments this month by roughly half. The same is true across the rest of the nation. This does not affect vaccine shipments that already arrived at our strategic national stockpile on Monday as part of our initial 109,000 doses for this week. Shipments to regional destinations across the state remain on schedule. Again, this is the latest from the federal government, so I wanted to make sure that all Illinoisans had the most up-to-date information on this rollout as soon as I do. I will continue to update you with new information as we learn it from the federal government. Thank you, and with that, I'd like to turn it over to Dr. Ngozi Ezike.
Thank you, Governor, and good afternoon, everyone. Thank you. Today, we are reporting 7,123 new individuals that have been diagnosed with COVID-19 for a total of 870,600 cases statewide. Sadly, we also received a report over the last 24 hours of 146 individuals who lost their life to COVID-19 for a total of 14,655 deaths in Illinois. Overnight, 4,793 individuals were in hospitals across Illinois with COVID. Of those, 1,045 were in the intensive care unit and 590 were on ventilators. In the last 24 hours, more than 93,000 tests have been reported, and we have just passed the 12 million test mark since the beginning of this pandemic. The excitement of the week continues as more vaccine gets pushed out across Illinois and into the arms of our workers in healthcare settings. And each week, although it may be reduced, but we will continue to receive new allocations of vaccine, and the number of people eligible to be vaccinated will expand. The news of the vaccine is cause for celebration, but of course, again, I reiterate that it does not signify the end of the pandemic, not yet, but it is the beginning of the end. It's this last mile, but that last mile of this super marathon has quite a few bumps and hurdles, but we will get through it together. First, we do need to get enough vaccine and have it readily available to the public at large. You've just heard about some of the decreases in the coming allotments, so we will continue to endure those challenges. Second, we need to make sure that people are actually getting vaccinated. There is a clear difference between vaccine and vaccination. Even if we had doses in the ultra-cold freezers for every individual in Illinois, if they don't come out of the ultra-cold freezers and get into the arms of individuals, we make no progress on this pandemic. Thirdly, we cannot forget the important foundational things that we have to continue doing, and that, of course, includes wearing our masks, avoiding gatherings, and keeping our distance to reduce the amount of virus circulating in our communities. Using this very layered approach will get us to the end of the pandemic, and then we truly will have that time for celebration. Thank you.